Hi, my name's Stephen O'Connell, and I'm the chairman of Desert Orthopedic Center and the director of hand and upper extremity surgery. Today I'd like to talk about common hand problems. There are 29 bones, 29 joints, 123 ligaments, 34 muscles, and 48 nerves in the hand. No wonder with this active lifestyle here in the desert, a third of all emergency visits for orthopedics are related to the hand, and 25% of sports injuries are related to the hand and wrist. Although in a common office day we see a multitude of hand problems, from repetitive strain problems, fractures, tumors, nerve, vascular problems, there are a few common ones that probably you or some of the friends you know have had. I'd like to talk about a few of those today. Certainly one of the most common problems is carpal tunnel syndrome. The most important role for treatment is trying to decrease the pressure on that nerve. Common conservative management is splinting at night, anti-inflammatory medications by mouth or possibly a topical gel, and probably the most successful non-surgical management is a corticosteroid in the carpal tunnel, which will shrink that swollen tissue, give the nerve more room, and hopefully decrease the symptoms. If people fail conservative management, we may send them to do a nerve conduction study test, a test frequently done by a neurologist that measures the speed of the nerve conduction velocity across the carpal tunnel. If it's slowed, that is the gold standard diagnosis for carpal tunnel syndrome. For those people who fail conservative management, a carpal tunnel release surgery is often performed, and it's certainly one of the most common orthopedic procedures performed, and takes literally 5 to 6 minutes of surgical time. The surgery is done with a small incision in the palm, 2 stitches wide. We release the ligament from here to here, about 3 inches, to decrease the pressure on the median nerve and therefore relieving the symptoms. Postoperatively, the patient is treated in a splint for 5 to 7 days and then started on an early range of motion exercise program, and they can perform light activities up to 5 pounds the day of surgery. The postoperative recovery is very brief, only allowing wound healing and increasing your activity to tolerance. And of course, another common problem in the hand is arthritis. Arthritis in the hands is very common, frequently affecting the end joints and most commonly the basal thumb joint. The basal thumb joint actually is the most common to require treatment. What happens is with the hand, you load your fingers against your thumb, so the thumb takes the most amount of force. So the force at the base of the thumb is 12 times the force at what you pinch. So if you pinch 10 pounds here, it's 120 pounds here. This incredible load in a small surface area frequently wears down this joint. People will have symptoms of pain with pinching, grabbing, opening jars. Most of the time this can be treated non-surgically with anti-inflammatory medicines, splinting, perhaps a judicious use of a corticosteroid injection. For those people who fail conservative management, a joint replacement can be performed, which has an excellent success rate, but should really be resolved for the people with intolerable pain who have failed conservative management. Thanks for listening today. As you can see, the hand has a multitude of problems, and we could talk about them forever. But if you have any problem in your hand or other parts of your body that require orthopedic attention, we have the orthopedic specialists here at Desert Orthopedic Center to serve you at all times. Please give us a call. We'd love to help you.